Can you come a little bit to the right? So greetings, and we're going out live very shortly in a couple of seconds. As you can see, my special guest is the eminent psychiatrist Dr. George Mikellides. Do stay tuned. We're going to be speaking about dementia. We've just heard the Sonata for Violin and Orchestra by Paganini. A reminder, you're tuned into a RIC Classic 88.2, and as we said earlier in the program, my special guest is in the studio here. We're also going out live on Facebook, and a very warm welcome to the psychiatrist, Dr. George Mikellides. Thank you so much for being here once again.
Thank you, Saskia, for inviting me.
So, today we're going to be speaking about a subject that is really difficult. Actually, I think all psychiatric subjects are not the easiest to discuss, but this one particularly, dementia.
It's quite challenging.
Yes, from many perspectives, probably from the person who's got it, the person who's living with the person, maybe also from a diagnosis perspective. Would you like to begin by telling us exactly what dementia is, a sort of broad definition?
So dementia is a diagnosis that usually we see in the elderly population, really. Mainly when we talk about dementia, many people get the idea that it's the same as Alzheimer's. So what actually is, Alzheimer's is a type of dementia. So affects 60 to 70% of people suffering from dementia. For example, when we talk about Alzheimer's, we're referring to a neurodegenerative disease, basically a destruction of neurons and brain tissue in the brain, which leads to cognitive decline. As a term dementia, we're referring to cognitive decline of patients. It's a disease which has different causes. So there's a dementia, a cognitive decline caused by, for example, strokes, vascular dementia, and there are different subtypes of dementia. We can go into more detail, but what we are referring to as dementia is a decline of cognitive functions. It's an irreversible procedure in a way, and basically what happens is the brain tissue dies off as well as the neurons, and people lose their functions, so their cognitive functions, really.
I want to ask, there's no way of repairing these neurons that have died. Is this under research at the moment? Because often we see stop Alzheimer's, even prevented. So those are different aspects, of course, I understand. But there's nothing actually that can repair those cells, brainstem?
Yes. What happens in the new era, in these years now, we are talking about neuroplasticity. It's a very exciting term, and I'm quite excited talking about it. It's the ability of the brain basically to create new pathways, new neurons, and try to repair these kind of procedures that happen in the brain. But in dementia, depending on the cause of dementia, then we need to understand the pathophysiology, basically what is actually happening in the brain that causes brain death. So, for example, in Alzheimer's, we're aware that different proteins are creating plaques and tangles, as they're called, that destroy the tissue, destroy the brain, and basically what the brain does is becomes smaller. There's a shrinkage of the brain, so-called atrophy. So there are some medications at this moment in time which have license to be used in Alzheimer's, which they can have a small effect of reversing this brain cell dying, basically, but the effect is quite small, and you can say that they could help stabilize a bit the disease, and perhaps very partially reverse the procedure of what's going on. But these actual medications today, they don't actually do miracles, and they can provide a benefit, but a quite small benefit. And I'm quite critical about this, that people should not expect that Alzheimer's will be cured with the medications we have today, because it cannot, with capital letters, I would say.
Yes. Let's go for the symptoms that we actually see, and is it the patient themselves who realize that something isn't okay, or is it usually somebody in the family?
I think it's a combination, and what tends to be the case is that some people will just say, oh, I'm just getting old, I just forgot where I put my keys. And small things that you might not notice, and you might attribute that just to growing old. So,
sorry, let's clarify old. Because I sometimes
Well,
forget my keys as well, and I don't want to think of myself as old. So tell me how. We say 68.
Some statistics say that above the age of 65, 1
Yes.
in 10 will have dementia.
All right.
Above the age of 85, 1 in 3 will suffer from dementia. So
All
these
right.
are some statistics.
All right, it goes up
So
quite
usually
proportionally.
when we're
Okay.
referring to dementia, we tend to think about people above the age of 65.
All right.
Depends. We're all growing old, so I don't think there is any stigma on the
Yes.
word old or being old, or it's
No.
everything's so subjective in this
It's,
life.
of
after
course,
all.
it's in the mind. It's in the mind. Anyway, let's go back. So, really, we see that it's the family, a combination of the family and the.
Yes, like for
and
example,
the person.
they will start not remembering faces or names. I don't know you, I've never met you before. Oh, I know you're my relative, but what's your name? Can you remind me your
Yes.
name? I haven't seen you for a while. They might have seen each other like last week. So short-term memory actually is affected.
Yes.
So it's one of the first things in Alzheimer's, that the short-term is affected. When we talk about vascular dementia, it tends to be a bit more affected by strokes, for example, in the brain. And the fashion of presentation is more like a stepwise fashion. So you have a stroke, and then your cognitive functions decline radically.
Yes.
Then you get to be stable for months or even years, and then you have another stroke, and then you have a quite a sharp decline in your cognitive function, where when we talk about Alzheimer's disease, it's much more gradual.
Yes.
So you might start to suffer from Alzheimer's when you're 65, but then your cognitive functions will decline over months and years in a much slower fashion rather than the vascular dementia.
If we focus on Alzheimer's, what are the other symptoms? All right, we're talking about memory loss. Are there any sort of behavioral symptoms?
Certainly. So one of the first things, as we said, is short-term memory loss. Then we have behavioral changes as well. People might get to be depressed as well, and they might stop eating, drinking, not sleeping very well. They might start to be irritable and start to shout, and
So showing behaviors, in fact, that were not really characteristic
of that person.
person.
Some people might
Yes.
say, oh, their personality has changed.
Yes.
Sometimes when we talk about personality changes, we tend to see this in frontotemporal dementia, which is another type of dementia.
Yes.
But we can also see it in Alzheimer's, depending on the whole kind of assessment we take into consideration. And some of these people also experience psychotic symptoms. Like symptoms like sound a bit like schizophrenia. We are
Yes.
not talking about schizophrenia, but we're talking psychotic symptoms, related to dementia.
Yes.
So you might start to think that, there are burglars in my house every night and they steal my cheese. And when you ask the patient, why would they steal your cheese? I don't know. When I go and check in my fridge, I see less amount of cheese. And they cannot remember that they ate half of the cheese earlier themselves.
Yes.
But they can see less, and they will start to be paranoid, and they will start to think that someone is there, is aftering them. They might start to think that they're not in their own house. They might start to think they're somewhere else, and they want to
Yes.
go home.
Yes.
I'm sick of this place. Actually, they're in their own home,
Yes.
and they want to go home. So it could be quite difficult to manage these kind of behaviors. And also sometimes you might hear voices, seeing things that are not there. Like there's a type of dementia called Lewy body dementia, where you've got this Lewy body structure in the brain, and you have this hallucination sometimes called Lilliputian hallucinations, when you see little kids in your house. So you have visual hallucinations.
Right.
So there are different types of dementia.
This is all very disturbing, but not only, of course, for the person, but for the family too. How difficult is it for the psychiatrist? First of all, how difficult is it to get the patient to the psychiatrist, and then for the psychiatrist to actually make an evaluation and to make a diagnosis?
Yeah, so just to clarify a couple of things here as well, because some people get this confusion that a diagnosis could be made by a psychiatrist who is expertising in this field of psychiatry or neurology. Neurologists could also diagnose people with dementia, and sometimes geriatricians as well.
Do you all work in conjunction or separately?
Depending where you're working. So in the public health sector, we can see that neurologists diagnose people with dementia, also psychiatrists. There are less neurologists in the public health sector compared to psychiatrists, so psychiatrists tend to do more work in the public health sector on dementia just because of numbers.
Yes.
We have started recently the memory clinic in Lacha, which is a specialized tertiary center for dementia, for assessing and providing treatment for dementia.
This must be one of the first in Cyprus.
Yeah, it is the first in the public health sector. It's the first memory clinic. So we actually, at the moment, because of number of staff, and we accept referrals from Nicosia, but we did actually, I did see patients coming from Paphos and Larnaca and from other districts to see us. We accept these referrals through either their GPs or any other doctor who sees them, so we're quite open to...
When was this memory clinic formed?
Last year, at the end of last year.
And, oh, so it's very
quite new.
And tell us a little...
So what we tend to do, we have an occupational therapist, a mental health nurse, and a psychologist. We actually work together as a multidisciplinary team. So we get the referrals from GPs or other kind of doctors, faxed to us. We are there on Fridays only, so we assess patients on Fridays. We provide the initial assessment, the diagnosis. We do different kind of tests, including neuropsychological assessments, scanning like MRIs, blood tests. Then
this is all done within your building?
No, the MRI scan is based in the general hospital, so people will have to wait for having the MRI done. No, we're trying to get them done as soon as possible. We actually managed to start having quite good results of getting MRIs within 1 or 2 months. So some of our patients had an MRI done within a month, and some of them actually are sent to the private sector by the ministry to get them done quicker because of the waiting list.
But you're only open on a Friday?
Yes.
In the mornings? Or all day?
At this moment in time, it's from like 7:30 to 3 o'clock.
I can only imagine that that's not sufficient time for the number of cases. Yeah. Or is it because it's new?
It's new, so we have started this as kind of a pilot, which is growing, obviously.
Right.
And as well as we have the general outpatient clinics of psychiatry in different areas in Cyprus that assess this kind of patients by the general psychiatrist, who also manages the case. So what we're trying to do is we're trying to provide a more specialized center for people with dementia. This is part of the National Strategic Plan on Dementia. So
it's very exciting to hear that there is actually a plan.
We're trying.
Mikellides.
We're trying, yeah, we're trying.
Because accolades must be given when due. We're always here to batter. So actually there is something being done, even if it's on a smaller and level that needs to grow.
The good thing about dementia, we also have the National Committee on Dementia, which we have representatives from different bodies like the Neurology Association, the Psychiatry Association, the Mental Health Services, the Ministry of Health. So we meet together every 6 weeks or so, and we discuss different things associated with dementia.
Yes.
And I have also represented Cyprus to the European Commission meetings on dementia that used to happen every 6 months,
Yes.
to discuss different member states of European Union, how we can apply strategic plans and how we can consider dementia as a very important issue of the new years, because it's the funding that needs to go into dementia is huge. It's not just medications, it's
No.
also we should be thinking about accommodation, we should be thinking about providing care in the community, providing care as an inpatient, providing care in general hospitals of people suffering from dementia.
And of course, giving relief to the
carers. And
Mm.
we have to think about the law in case of dementia as well. So, and there is also things that need to happen in Cyprus in terms of changing the law, respecting dignity of someone with
Yes.
dementia, and advanced decisions as well.
How far away are we in comparison to the rest of Europe in this regard, and with regard to the elderly?
So I think there are things that are changing. We need to think about care homes. We need to think about nursing, in community care. Things are changing, and I couldn't really say something at this moment because we're expecting the national health system to start working, which
Yes.
things will change dramatically, I would say. So
Are you speaking in conjunction with Gezi and the whole plan about that and incorporating this?
I think a lot of things will change, so it's quite premature to say where we are now, rather than where we will be in a year or two.
Okay.
But medications are available, or some types of medications are available free of charge within the public health sector, for example, as we have mentioned about Alzheimer's. And the different departments, the different ministries are trying to work in conjunction in terms of providing support to patients in the community. When we talk about psychiatrists and providing care, we all know that we're quite understaffed in terms of numbers of doctors, in terms of numbers of psychiatrists working in the public health sector.
Is this just in the public health sector or privately as well?
In terms of numbers, privately as well, I would say. But what needs to happen, we need to get more doctors to work in the public health sectors and have incentives to work and stay in the public health sector.
Yes, that's a whole other issue. That we need to actually call in, I think, the Minister of Health. I'm still waiting for him to answer my request for an interview, to speak about these subjects and what's actually going to happen. It's excellent about La Cham. So we've only got 1 day at the moment, but obviously you see the patients there. Then what happens after the diagnosis is made?
So what needs to happen is basically we need to start with a diagnosis, so we will know where we are.
Yes.
So when we have a diagnosis, then we decide about the management plan. The management plan could be a combination of psychological therapy for the patient or the carers if there is a need.
Yes.
And then it's about medications, as we have said. We also have an occupational therapist who could do some cognitive exercise and train the mind. So what happens is when we have patients with dementia, we need to try and work on training the mind. We need to stimulate the mind. And the occupational therapist provides cognitive exercising. Obviously, because it's just one person once a week, there might be a waiting list to have this done. But in some other places as well, we're trying to get people trained. I will be going to a course to Thessaloniki for 2 weeks on Sunday, and another colleague, a psychiatrist from Limassol, will join, and we get some training to establish a memory clinic in Limassol as well. So Limassol will follow as a second memory clinic, basically.
So now, on the whole, we've spoken about Alzheimer's, and I imagine that you've got patients from the Greek-speaking community, as well as the English-speaking community, and maybe even other languages too. how important is it both for the patient and for the family to be able to converse in the language, because we frequently see that things go out in Greek and we don't have help in English or in Turkish or in Arabic or so many other languages.
Yeah, I think that's true. We need to get more into looking to different languages and providing leaflets and support and care in different languages. What we can do sometimes as part of our assessment and as part of our treatment plan is, in the public health sector, we can book an interpreter so they could help us through the assessment process and through the management plan.
Yes.
But I suppose it's quite hard to have interpreters in different, if there is, for example, a care group, or if there is, for example, kind of group therapy or different kind of support provided. It could be difficult if the language is not there. It will be a barrier, and it's it's actually, we can see, like even in NGOs, the non-governmental organizations,
yes,
sometimes they might have difficulties in providing support for patients with dementia in other languages, especially apart from Greek language.
Yes, it seems to be quite an issue that
it's
also
an obstacle, and it's a barrier in terms of care, providing care.
We hear a lot about prevention. Do exercises, mental exercises, eat this, don't eat this, drink wine, don't drink wine. Is there any semblance of truth in any of this?
Yeah, there is some evidence. For example, olive oil, it's healthy, and we should be having olive oil in our salads, in our food. There are some studies that show that could be beneficial in terms of prevention of Alzheimer's. Thinking about Mediterranean diet in general, so
yes,
loads of fruits, loads of vegetables, and exactly, and so a diet is important, exercise is important, avoiding huge amount of alcohol. Maybe a glass of red wine could be actually beneficial, but maybe 3 bottles of red wine will be harmful. So everything
yes,
in moderation, as the ancient Greeks used to say.
Yes.
Then we need to think about exercising the mind, so puzzles and different ways.
So mental exercise.
Mental exercising.
When does this have to
It has
begin?
to be, you shouldn't stop exercising your mind at any age. It's not like when you retire you need to start doing puzzles. You should try to keep your mind awake your whole life. It's not like I'm 60 now, so let's start doing some puzzles. You should be keeping up the good work, because we can see in professionals like, maybe for example, professors in universities, the chances
yes,
of getting Alzheimer's is lower than someone else, because they keep their minds working.
Really, you've actually got evidence of
people, they keep on working and
right,
exercising their minds. It's beneficial.
Should I ask, is that why you're now starting another PhD?
Never stop, yeah.
All right, so actually that's important to keep going, actually, even from maybe your 30s. You finish
any age.
All right,
any age, I suppose you should be able to keep up the good work.
Is there anything specific? Reading, for those who don't want to do puzzles, I particularly, for example, don't want to do puzzles.
Reading, playing games, brain games. If you just write brain games on Google, there will be hundreds of different games or different apps you can use to try and use your mind. Also, as you know, I'm doing the RTMS, the Transcranial Magnetic Stimulation.
I was going to say, how effective is that in assisting patients with Alzheimer's in particular?
So there is evidence in this area that actually RTMS can help Alzheimer's. And I recently had a patient who has early stages of Alzheimer's, and he had RTMS, and himself and his son actually noticed a huge difference in his cognitive functions by having 30 sessions of brain stimulation. There is evidence even greater when you use RTMS. When you get your brain stimulated, at the time you get the stimulation, you do some cognitive exercise. It could be trying to find the wrong picture
Yes.
while you get the magnetic pulses.
Right.
So there is even a specific machine which has developed by Israeli and American company, which is RTMS, specifically done for Alzheimer's disease. And it's got an approval in Europe and it's awaiting FDA approval in States. So combining magnetic stimulation with cognitive exercise at the same time. So there is a machine developed for this and has got a CE approval in Europe for Alzheimer's, and it's awaiting FDA approval as well. So they have submitted a request from FDA to get an approval.
For those who missed a very fascinating program on RTMS, I encourage you to go back onto the Facebook page because it is there. But for those who are listening to us today, maybe you'd just like to give us
a couple of lines.
a couple of lines about RTMS, because it's a fascinating and of course you're the only one who's currently doing it here in Cyprus, and as you said, it's effective.
So RTMS
across the board, I think that's what
different things.
Yes, so many different aspects can be used for so many different things to help.
And I will mention actually, so let's start with the basic couple of lines. So repeat transcranial magnetic stimulation, it's a form of brain stimulation technique that uses magnetic pulses to stimulate different areas in the brain. We can see different chemicals produced, like dopamine, increased amount of dopamine in different areas where being stimulated, which can help in different things. It's a non-invasive treatment, so you comfortably sit on the chair. You can have and try it for 10 minutes if you want when you're around in Larnaca. I will demonstrate it on you for free. So you watch TV basically, and you get your brain stimulated. No major side effects from this. You can drive yourself to the clinic and leave from the clinic with no side effects. What happens? Your brain works a lot after the stimulation, so you need to drink 3 to 4 cups of water to rehydrate your brain basically, so you don't get a headache. Because 1 in 10 people might experience a headache after the excessive stimulation. So if you drink water, you won't get a headache. So when you're at my clinic, we can do that. So and basically it's got an FDA approval for depression. And recently has gained an FDA approval for OCD, Obsessive-Compulsive disorder. It's got an FDA approval since 2013 for migraines and related to pain. So it can have for neuropathic pain, for migraines. It can have a use in different other things. We can see every day being published different data on different mental health or neurological disorders. You can check my website as well if you want to have more information, cyprusrtms.com. And you can get more information in regards to these. It's an alternative to medications. It could be used as a top-up treatment with medications. So it's an option, it's a treatment option for people who have different kind of difficulties.
Now, what happens if you've got OCD, for example, and I've got the beginning of Alzheimer's, and maybe I want to quit smoking too. So I've got these things. Are you going to then, does one have magnetic stimulation to different parts of the brain where that is affected, or can you only go one by one, or just say, Saskia, you're beyond help? So,
okay. So when we talk about RTMS, that's a brilliant question. When we talk about RTMS, it's not just having one person could deliver RTMS a very different way of another doctor delivering RTMS, because there are 2-3 parameters here. There are different parameters you put in the computer, so meaning different frequency, different number of pulses delivered, different number of trains, different interval between the pulses. And also the site of stimulation of the brain. So usually there are 3-4 different sites we tend to use for anxiety, depression, Alzheimer's. There are 2 sites called dorsolateral prefrontal cortex, one on the left, one on the right, which has to do a lot with the emotional regulation, with the mood, and also to do with the concentration, where we can stimulate these areas also in dementia, for example, or depression or anxiety. When we talk about, for example, Parkinson's disease, we need to move a bit behind to the motor cortex, to the area which is actually controlling the movements. So left side controls the right side,
Yes.
right side controls the left. So we might try to stimulate the centers of the brain controlling movements. So you can actually see a person being stimulated on his right motor cortex, his left finger's moving. It's amazing.
Yes.
I'm stimulating the brain and
Yes.
his hand is moving.
Wow. Going to Parkinson, sorry, just to interrupt, do you actually, does it matter at what stage of the disease one is in to receive this kind of stimulation? What about someone who's quite in an advanced stage and who's already shaking and dropping things?
So what I would say is, obviously when we talk about some certain disorders like Parkinson's disease, it's more about managing the symptoms. I'm not going to provide a cure with TMS.
No.
So I'm going to try and improve the symptoms. So there are some studies done which actually talk about the tremor improving
Yes.
and also the rigidity.
Okay.
So it can have an effect on the rigidity and the tremor. I would say, obviously, as more advanced the disease is, the most difficulty is there to treat, and that's to do generally with a lot of the things. It's better to try in early stages rather than leave it at the end. But nevertheless, I would say that even at late stages, it could be an improvement. It could be a minor improvement, but still.
Or a delay, even. Right. As you said, it isn't a cure.
It could be a cure maybe for depression.
Can it be if you catch it in the beginning, in the first
Are we talking
stages?
about depression now or Parkinson's?
Across the board.
So for certain disorders like let's say depression, you can get TMS and you can go into full remission.
Wow.
So
Very effective.
So it could be, it's got an FDA approval for that.
Yes.
For example, migraines, there are some studies that suggest that up to 80% of people could improve in terms of the migraines, either number of attacks or even reducing it to no. So it could be the case as well. So for certain disorders which we understand a bit more about the causation, if we think that it's like a disorder which has started and destroys brain tissue, and there is a pathway of brain destruction, TMS will not stop this pathway of destruction, but can try and improve, let's say, brain cell death, perhaps, kind of like providing stimulation to some cells which are dying to try and wake them up. But it's not going to stop the complete pathway because it will not interfere with the causation progress. Because, for example, in Alzheimer's, when you have these amyloid plaques which build up in the brain and destroy brain tissue, TMS will not provide a destruction for the amyloid plaques, but it will try and help some of those neurons to survive longer.
Yes, or find another pathway within the brain.
Yeah, exactly, because we can see new synapses, new connections of brain cells being formed in the brain with the brain stimulation.
When you say FDA approval, we understand that that's the federal...
It's the Food and Drug Administration of the United States, yes.
Does that mean that so many studies have actually been conducted, documented, and noted?
Exactly, and it's actually another way of demonstrating that it's an effective and safe treatment. Because safety is paramount. That does not create any problems, really.
So if we compare the FDA with the European version, I'm familiar with FDA, I don't know the European one.
Yeah, there is different kind of like, there is the CE in Europe that provides certificates of standards and
Are you then compliant with
for example on depression, the NICE UK, the National Institute of Clinical Excellence, has provided a statement that it could be used for treatment-resistant depression. But and also in FDA, you have to use one antidepressant that you fail before you are given by the insurances the green light to have the treatment. But this is only to do with financial cost. It could not just, as I have mentioned in a recently published article by myself, that TMS could be used as a first-line treatment in depression, and there is no apparent reason not to, because it's all about the money. It's all about the cost benefit. It's easier to get a €3 medication than go and have a TMS, which is going to be much more expensive to the person who is providing the treatment.
That seems absolutely unacceptable to hear something like
But
that.
that's the case when you look, for example, the whole system is based on this. Like when you see the National Institute of Clinical Excellence in the UK functions on cost benefit. So why should I prescribe you something which is more expensive when something cheaper provides a good effect, a sufficient effect? Why should I give you something more expensive?
So can you answer the question?
No, it's an ethical question and people could just think about it.
Yes. We have a question from one of our viewers on Facebook who says, Dr. Mikellides, can stress in one's life eventually contribute to dementia? A very interesting question, and I'm glad to bring that up because we seem to be surrounded by stress from the minute we wake up, or let's say after that first cup of coffee.
Absolutely, yes, is the answer. And if people suffer from depression or anxiety or any other type of mental health disorder, they should get treatment for it because it can actually lead to dementia. A lot of stress destroys the brain cells, not just the brain cells, but also the human body. So we know that depression, anxiety is related to heart diseases, diabetes. We know that there is a causation between those disorders and physical health problems. So get treatment as soon as possible.
Stress causes death of the brain cells.
Mm-hmm.
I think that that isn't said enough. Can we go into what type of stress? Because stress for somebody can mean one thing. I can't find my keys, and you know, one of my family has died. That's a whole different level of stress. I've just lost my job.
Mm-hmm.
I've lost my house. My finances are out of control. Different levels of stress. Where do we
Put the line.
put the line? And where would you say is that line where you have the beginning of the death of brain cells from stress?
So I would say the specialist will put the line, and that's the psychiatrist. So if you feel that you suffer from excessive stress, the best thing you could do is to see a specialist in this area to tell you if you have actually crossed the line. The good thing about it is most people are able to identify when they cross the line, when we talk about stress and anxiety.
All right.
And in psychiatry, we generally speak about people suffering from anxiety disorders or any kind of mental health disorders when their functionality has been affected, basically,
yes.
or compromised. So when we have difficulties completing our work, when we have difficulties getting home on time because we spent 3 more hours at work checking the letters, when we could have finished on time by doing the job with less stress, in less time.
That one is difficult.
So
What happens if you're actually in a work environment where you're given too much to do?
So you might develop an anxiety disorder if you're working in such a toxic environment. So what you need to do is either quit your job and try to find a less stressful job, or get treatment for your stress so you're able to cope in that toxic environment, or sometimes both.
Right. How do you cope in a toxic environment?
Okay, with more serotonin in the brain, I would say.
Okay, so we're going to eat more chocolates, we're going to exercise
well, maybe
more.
an antidepressant could help, but
Okay. For those of us who don't really want to go down,
there is TMS, you get more dopamine in the
yes,
brain.
all
But
right.
what tends to happen is, if you work in a toxic environment, your mental health will be affected. You need to do something about it.
Yes.
You need to probably quit your job if your mental and physical health. You will start getting tinnitus. You will start having this buzzing noise in
your
the
ear.
ears.
Yes.
You will start having stomach aches. You will start having constipations. All these physical health symptoms are related to your psychological mental health state.
People often will say back, I can already hear them saying, but I can't leave my job. Where am I going to get another?
So that's why I said you need to try and get treatment, Because if you actually get treatment, if we're referring to medications, etc.,
Yes.
you will see that you will be able to cope with much more less stress at work. You will not pay as much attention to things that are troubling you today because
Yes.
your boss has said something bad to you. You will just dismiss it.
Yes.
I'm
It
not
takes
saying
a long time to get to that stage.
I'm not saying that's the way to do it.
No, I
but
think it's a very positive
it's
thing.
useful to think
Yes.
that you can save your brain, your heart, and your pancreas, perhaps,
Yes.
from I'm talking about diabetes and heart
Yes.
and dementia, by getting treatment. If your anxiety levels are too high, if you have low mood, if you cannot sleep at night, if your appetite has been, your libido has changed, these are very important things to take into consideration. And because we're talking about dementia,
I was going to say,
I will come to the term so-called pseudo-dementia.
But can I just, before we go that, I'm
Yeah.
going to write pseudo here, pseudo-dementia, not to forget. And Igonisa asked one other question, and environmental and friendships. Friendship, how important is that?
They're very important.
Also in eliminating and coping with stress.
Having a supportive environment, it's brilliant. We all need to have a supportive environment, like relatives, friends,
Animals?
to support us. Animals, we all know, or most of us know, about the pet as a therapist, which
Yes.
is used in different countries, even in care homes, that dogs or cats are taken there, and residents are helping in raising those animals. It's very beneficial for someone's health.
Have we progressed well enough? Yeah, it's fascinating
Yeah,
speaking to you
yeah.
because we go off onto the one other tangent. But on the fact of pet therapy, have you actually incorporated that from the public health sector into helping patients with their mental health? Have dogs actually been taken in?
I work in different kind of jobs I'm working in. I work in a place called Themea, which is for alcohol rehabilitation.
Yes.
We actually have a dog there, which is beneficial to see walking around.
Yes.
Not in a sense as such that we use it as a pet therapist, but it does provide a bit of a role
Yes.
there in terms of assisting patients through their rehabilitation coming off alcohol or benzodiazepines.
Right.
But it's a thought, and I think we need to take steps in Cyprus in using this in our different kind of work, using pet as a therapist, because the evidence is there. It's helping people in different countries.
Yes.
The sense of providing care to a pet, it's a mutual beneficial for the pet and for the person who is providing this care.
And it's an unconditional love,
It's
I've
unconditional
discovered.
love, yeah.
Yes. The
That's
husband
true.
can leave, but the dog doesn't leave. They stay,
That's
and
true.
they love you.
I mean, obviously, the lifespan of a dog, it's not huge, but
No.
And then we get emotionally affected
Yes.
by pet's death. But what we can do, this is life. We're all dying. It's just all
Yes.
about timing, really. And if you're
Right.
70 and 75 and you get a dog, maybe you live to see each other until the end.
Yes, yes. Let's go back to pseudo-dementia.
Yeah, because we were referring earlier to depression and stuff.
Yes.
So pseudo-dementia is a term used usually for the elderly and for people above the age of 65. So what we tend to see is that some people might start complaining about having memory problems,
Yes.
not remembering things, having trouble sleeping, not feeling too good. And some people will start to say, "Doctor, I think I start to have dementia. Can you check me out?" But when we do the test, when we screen for dementia, because there are different blood tests we do, there is also a brain scan, either a CT or MRI. MRI is a much better way of scanning, and we should be using that more, and we are. And we identify different symptoms of clinical depression or anxiety disorders. We can see that this person is actually suffering from depression or anxiety rather than dementia, but they present with memory problems, because we should not forget that people suffering from depression or anxiety, even in their 30s, they
Yes.
suffer with concentration problems, memory difficulties, And this is just more related to either a depressive disorder or an anxiety disorder. So when you cure, let's say, the depression or the anxiety, you can see that the memory improves. There is also a screening we do for people with memory problems. We should mention that as well, Saskia.
Yes.
You're about to say something, but I stopped
No, that's good.
So we check for thyroid function, because thyroid, either hypo or hyper, can affect the brain. Usually, mostly when we talk about hypothyroidism, people develop memory problems, which are reversible, they might get thyroxine, the hormone, and then their memory improves.
Yes.
Then we can see this in vitamin B12 deficiency. And what happens as we grow older, let's say, because we are all growing older.
Yes, I'm still in denial on that one.
Yeah, we absorb less vitamin B12.
Yes.
So we have less vitamin B12 in our body. So that can affect the neurons. So that can affect our memory. So by improving the levels of vitamin B12, usually by injections, because if the vitamin B12 is not absorbed, then if you take tablets of B12, they will not be absorbed. So
what about those fluorescent?
No, you just need injections.
Oh dear. Okay.
Okay. And obviously you need to think about vitamin D sometimes, because that can lead to depression as well.
Yes.
Folic acid, also low levels of folic acid. This is pretty much in terms of, apart from the full blood count and electrolytes, etc. This is a kind of a screen we do for dementia, because people might present with dementia, but you cure the underlying B12 issue, and they're fine.
I should think that also provides a huge sense of relief, because somehow being diagnosed with pseudo-dementia, knowing that you can actually do something.
That's reversible.
And reversing, you can actually reverse your stress.
Yeah,
it seems ridiculous to have stress when it can actually be reversed.
Yes, and I can see, especially in men, that they're afraid of stigma. They're afraid of saying you're not mature enough, and you see a psychiatrist, you're weak, you've got depression.
My next question. Yes.
Why should I go and see a psychiatrist? I'm not mad. I've got a bit of stress. Who doesn't? But actually, some of these people will be suffering of great amount of stress. Some of these people might be depressed and they're not seeking help.
I think that if there were more psychiatrists who were really just like you in your approach, it would be much easier and there would be much less stigma attached.
Thank you, Saskia.
I think that that's one of the issues, how the doctor actually relates, and they're professional, they know what they're talking about, and yet they speak to you in a very clear and succinct way. Because I think when somebody actually goes to see a psychiatrist, they really want answers. It's not that they want to skirt around the subject. They want to know we need a cure. You should
try and use lay terms, so lame terms for people to be able to understand.
We sort of touched on the carers of people with dementia, but we didn't really go into how difficult it actually is. And it's a long-term care. It's often, I think, 10, 12, 15 years that the person is there, showing a slow decline.
Yeah, some studies in the past have shown that at the time of the diagnosis of dementia, 50% will die within 5 years. So some studies show that today that the average, or let's say not the average, but the spectrum of living after a diagnosis of dementia is 3 to 14 years. And only a very small percentage, like 4%, will live after that. So it's a kind of a life sentence, and it's not just for the patient, but for the carer as well. Especially when you see couples that they used to be together, they are still together obviously for 60 years, 70 years, and they start to see a complete different person in front of them. Complete different person cannot take care of, like, brushing their hair, brushing their teeth, taking a shower, cooking for themselves, getting dressed, not knowing their whereabouts, not able to recognize their children, not recognizing their grandchildren, not able to drive anymore. It's like you become so unable to do your daily routine, and you're depending on someone else who usually is your partner or your daughter or your son or someone that you have as a carer and looks after you 24 hours a day. So it's very challenging, really.
What happens to those carers? Because I think frequently we see that the person is being looked after in the home, in their home environment. I think probably that is helpful to the person who's suffering from dementia rather than being put into a home. But what services are offered to the actual carer? What terms of respite, relief, caring, and how do you actually get the carer to admit that they need time out? Because I think that that's also a very difficult subject to say, come out of the environment for an hour or two.
I think respite is very important. There are different places in Nicosia and Limassol. There are day centers, usually by the NGOs, who provide a place where you can actually relate to others with dementia, support the carers, support the patients. That could be a good respite, even a few hours a day in a day center. Obviously, the difficulty there sometimes is transportation as well, that there is an issue. And also when we think about respites in a much more 24-hour aspect, it's not really available rather than just the private sector. So people will be able, they need to afford to take their loved ones for a few days in a respite. Sometimes we do get patients admitted in a mental health hospital with behavioral issues related to dementia, which is not the best place for these people to be admitted in a mental health hospital, rather than in a place who are well trained and are able to provide someone with their needs and what they actually need. But we should not forget that sometimes this behavior could be very challenging and very destructive. So they might need sedatives sometimes to calm themselves down. But we have to be careful as psychiatrists or as doctors in general when we're prescribing sedatives in this group of people, because they're very vulnerable, and they can have falls, and they can have fractures of their hips if they fall because of sedation. So we have to be extremely careful.
In order to wrap up, if there's somebody now who's been listening and following the program, what is your suggestion about what they can do? They actually first need to go to the daycare center, or can they contact you directly?
So if they want to see us in memory clinic, what they need to do is, if you type Kliniki Mnimis mental health services Psychiatry on Google.
Oh, and this is only in Greek? So for our listening...
I think so. So if you type Kliniki Mnimis, or if you go on mental health services on our website, there is Kliniki Mnimis. It's the memory clinic basically. And there is a referral letter that any doctor could fill it in and fax it to us. And we will call them up and give them an appointment for an assessment. So this is for memory clinic in Lecce. So if someone is suffering from any kind of memory problems or anxiety or any other mental health disorder, they can go to their hospital in Larnaca or Limassol or Nicosia, and they can book an appointment to see a psychiatrist, for example, so they can have an assessment done. That's in the public health sector, or they can also book themselves in a private psychiatrist to see and have an assessment. Just to remind everyone, as soon as you do something, better results you will expect, because if you delay this, things will get worse, and if things get worse, then it's much harder to get them better.
So try and eliminate the stress, and for those who want to discuss further with you about RTMS, where can they find you?
They can call me on 99430-330, or they can check my website, drmikellides.com or cyprusrtms.com.
Alright, so let me give the number once again, 99430 330. Have an extra 0. 99430 330drmikellides.com. It's been fascinating once again. Thank you so much for your time to speak to you, and I hope that people will follow your lead, and remember that stress kills the brain cells, so not to overwork and to eliminate the stress.
And just a final thought, you cannot really say to someone don't get stressed, because you can't. You need to find ways of getting the stress out of your life, really.
I think that music is also good stress relief, so then let's move on to some music. This is Daniel Barenboim and Consolation.